All right, hi. So today I'm going to walk through a conversation about discussing an ADHD diagnosis with the parent of a 10-year-old child. These discussions can be challenging because ADHD often responds very well to stimulant medications, yet many families have concerns about possible side effects. Parents may want to begin with behavioral strategies instead, and it's important to approach this with empathy, clarity, and collaboration. So today, thank you for being here today. Based on our evaluation, including the teacher's questionnaires, your observations, and the clinical assessment, your child meets the criteria for attention deficit hyperactivity disorder, also called ADHD. ADHD can make it harder to focus, stay organized, complete schoolwork, and sometimes it can affect social interactions as well. The standard treatment usually involves a combination of behavioral therapy and, for many children, stimulant medication, which tends to be very effective.
We understand, but we're not comfortable starting medication right now. We've heard about side effects like appetite loss, sleep problems, and mood changes. We would really prefer to try non-medication approaches first.
I appreciate you sharing that with me. It's important for me to understand your goals and what treatment options you feel comfortable with. Could you tell me a bit more about your priorities for your child? For example, would you be open to starting with behavioral therapy or school-based support?
Yes, absolutely. We'd like to focus on behavioral interventions and school accommodations before doing anything with medication.
That makes sense. Are there any specific experiences or concerns you've had with medication, either personally or with people you know, that make you hesitant?
We've heard stories online about kids having insomnia or losing weight. We want to avoid that if we can.
Your concerns are very valid. Stimulant medications can be extremely effective for improving attention, reducing impulsivity, and supporting academic and social success. And if side effects do occur, we can adjust the dose, switch to a different formulation, or consider non-stimulant options. Early treatment can sometimes help prevent frustration in school or social settings. That said, I also respect that every family has a different comfort level.
We still feel strongly about avoiding medication for now.
Thank you for being honest about your preferences. We can absolutely start with an approach that avoids medication while still supporting your child's needs. Here's a plan that keeps safety and effectiveness at the center. First, we'll start with behavioral therapy with a licensed therapist who specializes in ADHD and child behavior. We can work with your school to set up accommodation, like things like structured routines, scheduled breaks, organizational support, and possibly a 504 plan or an IEP if needed. We can use daily or weekly symptom tracking, both at home and at school, so we can monitor attention, behavior, and academic progress. And let's schedule a follow-up appointment every 4 to 6 weeks to check in, review progress, and adjust a plan if needed. I can provide you with parent-teaching resources that also support consistent behavior strategies at home. This plan allows us to respect your wishes while still actively addressing the challenges your child is experiencing. My goal is to support your child's attention, learning, and social development in a way that aligns with your family's values. We'll continue to work together, monitor progress closely, and adjust the plan whenever needed. And if at any point you'd like to revisit the option of medication, I'm here to guide you through that conversation as well. All right, thanks.